For post-acute COVID and chronic Lyme disease, are patients staying on LDN indefinitely, or are they able to be weaned off without symptoms after a period of time? And does LDN help eliminate or just alleviate symptoms?
Yeah, so good question, two-part question. So number one, I have yet to take anyone off of LDN because this is so new and so evolving. I certainly don't want to stop a therapy that seems to be helpful. The only time I would stop LDN is if there was some untoward effect, adverse effect or side effect that was intolerable, or the patient felt that the expense of LDN did not outweigh any benefit that they saw. So I usually leave it up to the patient. Some will just discontinue it on their own against my advice, but I have yet to really pull anyone off of it. I think I'm of the feeling that when we're dealing with autoimmune diseases, if we're dealing with cancer, and we're dealing with long COVID, that you've got to keep people on LDN for a particularly long period of time, maybe 6 years. I don't have the right answer because we just don't know yet how long it will be till you get rid of all the spike and all the other issues. And we haven't even talked about vaccines. So, I think it would be foolish to take somebody off too quickly. Somebody has to be completely symptom-free for quite a number of months before you elect to take them off of an agent like LDN.
And the second part of the question, does LDN help eliminate or just alleviate symptoms?
Well, I think it can be used both ways. I think you can use it as sort of a helpful Band-Aid to help with some of the symptoms. Like I BID or twice daily dose LDN, and I pair it up with agents like amloxanox and rapamycin, and especially the cannabinoids, CBD, CBG, maybe some Delta 8 if appropriate. If I pair up LDN with the cannabinoids, and I've lectured on this before, it's very helpful with things like chronic pain condition or regional pain syndromes, as well as insomnia, as well as depression and anxiety disorder, all of which are heightened when people suffer from long COVID or even Lyme for that matter. You see a tremendous uptick in people with anxiety disorder, depression, suicidal ideations, and insomnia. People get racked with intractable insomnia. So LDN helpful when paired with CBD or agents that have multiple cannabinoids, I think are very helpful in treating and helping with pain and some of these other things. But I also feel that strongly that the LDN itself is part of the curing process to help cure the disease by modulating the immune system. Once the immune system is ramped up to be highly productive and efficient without going overboard into becoming something that attacks one's own body, and that's the beauty of LDN, it modulates it. And then once that happens and the immune system is returned to a healthy state, I think you can start peeling away some of the nutraceuticals and drugs that we use to help people, including LDN. It's not meant to be taken forever necessarily, but I must say with caution that I would be very hesitant to take a recovered cancer patient off of long-term or maybe lifetime LDN treatment, or anyone with multiple autoimmune diseases.